All right. Hello, everybody. My name is Jessica Beams-Tabor. I am an IBCLC, that is an internationally board certified lactation consultant. I'm here from the Breastfeeding Center of Ann Arbor. That is a small private practice in Ann Arbor where myself and a couple other team members provide support. And I just want to give a big thanks to the Ann Arbor District Library and the whole team behind the scenes here that has brought this session to the community, which I think is so amazing that our library does things like this. Like, obviously not all libraries do this, so I'm sure everyone really appreciates it. So thank you so much to the library and the team for doing that. A little bit about myself. I live here in Ann Arbor on the west side of town. Westgate is my library branch that I'm usually at. And I have 2 kids. They are 8 and 5. And my husband is a teacher, so he's in the community as well. He's at a small school called Clonlara, if anyone knows of that. So that's a little bit about me and my family. And with that being said, let's just dive in first to what we're going to be talking about today. So we are going to be talking about both breastfeeding and bottle feeding essentials. So mainly I want to cover how much to feed the baby, because surprisingly, there's not always a ton of information out there about that, but it's pretty straightforward. So that'll probably be helpful. Also, how to build your milk supply, latching the baby at the breast or the chest, bottle feeding techniques, and throughout we're going to talk about resources, both things that are online that we love to point clients to, and also resources from the Breastfeeding Center of Ann Arbor. So hopefully this sounds like you're in the right place. I did design this mostly for folks that are expecting babies. So prenatally, or if you're expecting a baby. So if you have a baby already, that's fine. You'll probably get some information out of this. But this is more designed kind of prenatally, for folks that are planning on the baby on the way, just so we know about that. All right, so just to touch a little bit on what we offer at the Breastfeeding Center of Ann Arbor, and we'll talk more about this at the end. But again, like I said, we are IBCLC lactation experts and infant feeding specialists. So that IBCLC part, what that means is that that's essentially the highest level of lactation certification, lactation professional certification that you can have. There's lots of other acronyms in the field. There's like CLC, that's a certified lactation consultant. There's CLS, that's certified lactation specialist. There's a lot out there. But that IBCLC is the board certified, internationally board certified. That's a years-long process to get that certification. So we have to take a bunch of college courses, a bunch of lactation-specific education, and the main part is also hundreds of hours of clinical experience. So for the path that I had 500 hours of clinical experience with an IBCLC mentor. And then after all of that, and that usually takes multiple years, then we sit for a board exam and have to pass that board exam, and then we are certified, and we recertify every 5 years. So I always just want to share that so that you just have an idea of what that acronym is telling you. It doesn't mean that someone that doesn't have that, isn't doing a good job or anything. It's just that's the level of training and kind of the professional level, behind that. Okay, and then we said we are lactation experts and infant feeding specialists. That's the other piece. I feel like a lot of people sort of have heard of or think of lactation consultants as only care about feeding at the breast or chest and maybe only newborns. But that's not the case. I'm sure there are some out there that's kind of their specialty and that's what they focus on. We focus on a much wider range than that. So we are doing everything from prenatal, newborn, all the way up to throughout the first year, toddlerhood, anything feeding related in that first year especially, but even beyond, and anything lactation related. So bringing in a milk supply or deciding to decrease a milk supply or any pain or problems or anything that can come along with that. So it's a really wide range of expertise that we have. And I just want to make sure people know that because a lot of times they don't realize that's a resource, that they can use. Okay, so you can see down here at the bottom, just kind of skipping ahead, all these different, and this is just brushing the surface, different things that we help with. So not only at breast or chest feeding, but bottle feeding, using formula, using supplementation, getting ready to return to work, pumping, starting solid foods, around 6 months, weaning eventually or whenever that's right for you, starting to decrease milk supply. All of that is within our scope, okay? And I want to also point out back up here, that for private consultations that we offer, these are covered by insurance in most cases. And a lot of people are not told that, are not realizing that lactation support is part of what you're already paying for. If you have an insurance plan and you're paying for that, you are already paying for this support. So this is not, completely out of pocket cost. Okay, so spread the word. A lot of people do not understand or aren't told that lactation support is covered by insurance. So this isn't, I'm trying to get you to come in and spend money with us. This is, I'm going to be paid via your insurance plan. So that is a support that is available to you. Okay, so I think that's all I want to touch on right there for now. We're going to talk more about the resources that we offer at the end as well. And one other thing I'll just mention, about me and my background is I started as a client at the Breastfeeding Center of Ann Arbor 8 years ago with my first, and was in a completely different field of work. I actually was in corporate HR and worked there for 12 years and was in, a totally different line of work, and started as a client, had a lot of breastfeeding issues with both of my kids. And the founder of the center, Barbara, was my lactation consultant. And very long story short, 8 years later, here I am. I completely changed careers and, entered this field and went through that whole certification process. And this is what I do now. And I also have a background in adult education. So I have a master's of education in adult learning. So I love doing things like this, providing education to the community and to parents. And we also do a lot of professional education too. So we actually educate and train a lot of aspiring lactation consultants or existing lactation consultants. So that's part of what I get to do with that education piece of this. So that's just a little bit about my background. All right, so the other thing, about breastfeeding specifically, and again, we're gonna talk about all kinds of feeding, is we're gonna talk more about this later too, but it says here what people say about breastfeeding, and this is pretty common, that people hear, the baby will know what to do, your body's gonna know what to do, it's all natural to be beautiful and easy. And the reality is usually pretty different than that. So this person at the top, this is not who I am, this is not who we are at the center that I'm at, that, we go into this knowing that this can be really challenging for families and for people that are breastfeeding, okay? So it's not, your body will figure it out and it's all natural and wonderful. If that is you, I'm so happy for you, but that's very rare. Okay, so we're more about there's probably going to be challenges and we can help you resolve them and we can help you get there and we can help you with whatever goal is your goal. Okay. All right. I'm just looking at my notes to see. One thing that I did want to mention with this session as well is that I've designed this assuming that you want to breastfeed. And I don't know if you want 100% breastfeed or what your plan is, but studies show that most people, the majority of folks, 80% or more, plan on breastfeeding. So that's the assumption that I have when I design this. If that's not you, if you're not planning on breastfeeding at all, there's still information that you will get out of today. And I'd love for you to reach out because a lot of times folks in that boat, if they know they're not planning on breastfeeding at all, I think they really actually get not enough support even for that, because what usually people aren't told is your body is still going to produce that breast milk early on. And if you don't have a plan for that and managing that, you could end up with a lot of engorgement, a lot of pain, a lot of issues. So I feel like that's an under-supported group too. And we're very happy to help with that. If you are planning on completely formula feeding, absolutely reach out to us. Any of this. There's so many different ways to feed a baby. Whatever your reality is, please feel free to reach out. Okay, but like I said, today I'm assuming you're planning on breastfeeding because most people are. Okay, but I realize that might not be true for everybody. And this is the reality. This brings up one main thing I also wanted to mention is that, we named this session Bottle Feeding and Breastfeeding Essentials. This is not an either or at all, okay? Most families are doing some combination of breastfeeding and bottle feeding, and that proportion, how that looks, absolutely can change over time. There's all different reasons that people are using bottles or not deciding to breastfeed or whatever the case may be. But the reality is most people are doing both. Most people are doing breastfeeding and doing bottle feeding in some way, shape, or form. So this is not an either or. It's absolutely not an all or nothing either way. So I just want to make sure we all have that mindset that both of this, breastfeeding and bottle feeding, applies to anybody. And that's how I've thought of this, okay? So what this could be pumping, this could be, and breast milk is in the bottle, this could be using formula, and that's what's in the bottle for the baby. This could be breastfeeding at the breast, at the body, direct feeds, or it could be someone's gonna exclusively pump, and that's what their baby's gonna get. So many different combinations or ways that it can look. So thinking of it as like, probably both are going to happen in some way, shape, or form for you and your baby. Okay, so with all of that said, let's jump in to some of the information here. So first of all, this is the information I talked about that is pretty straightforward, but not usually out there a lot, I find. And that is, how much does my baby need? So this is a summary table that I've put together. We have these as actual, postcards in the office. So if you ever come into our center, we can hand this to you. You can put this on your fridge. That's kind of what I picture people doing with that. So, but this information, is really important to know, because if the baby is not feeding at the breast at every time, then we need to know, well, how much am I supposed to put in this bottle? What's the right amount? Right? So, and that changes drastically over the first week, and then it continues changing week over the first month. So depending on the age of the baby and where you're at, this is going to be really different. And just kind of guessing or nobody telling you the right amount really can result in the baby being underfed or overfed, which I find is actually more common. So knowing what the right amount is, that's what this page is. The other thing is how many feeds per 24 hours. Okay, so this is something that people, maybe aren't told kind of how this changes over time or what to expect. And the first couple of days, especially, you can see here, it is a lot of feeds, because they are small feeds. I mean, we're talking about drops, at most maybe half an ounce, 10 ml. I mean, these are small amounts, but very frequent is really normal. And we're going to talk about how important this is when we're working on bringing in a milk supply, how important that is. But this is what the baby's body is also expecting. So if the baby isn't feeding well at the breast, or you're choosing not to feed the baby at the body, if for any reason we're giving this baby bottles or syringes or whatever the case might be, these amounts and this frequency is important to know. This also then applies to if you are pumping or expressing. How much am I supposed to get? How do I know if my supply is on track? How do I know if I'm getting the right amount? These are the amounts. This is what also applies to that. Okay, so this is where if you're expressing in any way, you can look at this, you can pull this out and see, okay, am I on track or not? Okay, so I'm not going to go through, line by line here, but I just wanted to show this, and then this can be something obviously that people can refer back to on the video, or you can reach out or come into us and we can share this as well. And this also applies to whether we're using formula or breast milk. Okay, so sometimes people also get confused of like, am I supposed to use different amounts? Formula is designed to be, it's 20 calories per ounce, which is the average that breast milk is as well. So it's designed to be 1-to-1 ratio. Okay, so we don't need to be thinking of it at all as different amount for formula or breast milk. Okay, in general, we can expect it to be the same. And then we'll talk about, if there's signs like the baby's weight gain is not on track with these amounts, then that tells us, okay, maybe your baby does need a little bit more or a little bit less. But these are a good starting point, and this is the average, and this is what does apply to most babies. However, if you do have a preterm or a baby that has something going on medically, or maybe they were small for gestational age when they were born, they have less kind of fat on them when they're born, your doctor or your pediatrician might give you different amounts. Okay, so these amounts that I have on the screen right here are for full-term healthy babies. If your doctor determines you need different amounts, then go ahead and follow that, okay? Trust the pediatrician or the neonatologist or whatever they were telling you early on. And then generally, once they've gained enough weight and they're on track, then they kind of shift to these normal average amounts, okay? All right, so hopefully that's helpful to be able to refer to this to see how much to feed the baby. Okay, so let's talk about building milk supply. And what I find is that people don't always realize how important it is to get those frequent feeds in, because supply and demand is what the system is all about, okay? I just found this today and bought one for someone I know who's pregnant. And we've got supply over here and demand, well, right here, really. So that is what the system really is. We think of it as supply and demand. Every time that milk is removed, that's demand. That's telling the body there is demand for this, so then the body produces more milk. Okay, so that frequency that I talked about is really important to tell the body, yeah, that baby's here, that baby's hungry. Those early days, if they feed 15, 16, 18 times, remember it's small amounts, right? But that frequency is telling the body, okay, I gotta increase this. I gotta increase this. And then the frequency slows down a little bit as the volume increases, but we still want frequent, effective milk removals to bring in the supply, to get the supply kind of kicked off the ground and really ramping up, and then eventually to maintain supply. This is important too. Okay, so by milk removals, I mean either babies feeding directly, removing the milk themselves, or if that's not happening, then this could be pumping, this could be hand expressing, this could be using a tool like a Haka or another vacuum passive pump or a hand pump. So lots of different ways to remove the milk. And removing that milk is the demand signal to tell the body to increase supply. Okay, so frequent effective milk removals. And again, just going back here, well, what number of frequency are we talking about? How many times in a day? That's what we're talking about here too, okay? So these numbers apply to, in order to bring in a good supply and build that supply, these are the frequency or the number of times per day that the body is expecting milk to be removed to get that signal, okay? So again, we don't have to be relying on the baby to do the milk removal. If this is pumping, if this is hand expressing, if this is something else, that can be milk removal too. We just want it to be effective, which means it's pretty much emptying the breasts. They're never like bone dry, completely empty, but removing a good amount of milk, again, in line with that chart that I just showed you, that amount, that's what tells the body to keep making more, okay? So one little activity, I'll kind of explain this and you can do this on your own time. One thing that I have people do a lot is think about over the last 24 hours, how many meals did you have? And jot that down, okay? Then you're gonna think about how many snacks did you have? And you're gonna jot that number down. So now we've got meals and snacks in the past 24 hours. Then you're gonna also think about how many drinks did you have? Okay, so I'm not specifically saying alcoholic drinks, but like any drink, so like how many 8 ounces of water or whatever beverage. Okay, so how many drinks would you guess that you had in the past 24 hours? And then we add all 3 of those up. And my guess is when you add this up, because I've done this many times with many people and many groups, usually, and if you're watching this on video, like pause and do this for yourself so you can actually get your number. But usually, once you have your number, then it's somewhere in the range of 12, 15, 16, 8 or 10 on the low end. That's usually kind of some outliers, 20 or more on the high end. But the average across groups usually ends up somewhere around 12, 14, 15, something like that. So my guess is your number is probably that. And if you had a 8 or something or lower, that's really low. Usually the low end is like 8, 9, maybe 10. So then we think about, yeah, that makes sense that babies are feeding that many times a day too, right? Like we don't just have our 3 meals a day. We also have snacks. We also drink. This is their hydration too. So when we add all of that up, suddenly it's like, yeah, it makes sense that they're feeding 10 times a day. Like that doesn't sound like so many when we realize we're doing it too. Okay, so frequency, is important. Many times a day is important, both for the baby to get what they need and when we're breastfeeding to get that milk removal to tell the body to keep increasing supply, okay? Unfortunately, I feel like what I hear a lot is people will say, those early days, the first 3 days, well, I didn't bother feeding the baby or I didn't bother pumping because my milk hadn't come in yet. So like, why bother anyways? And the reverse is how we need to think of that. It's small amounts. We expect it to be small amounts early on, but we need to get that removal happening really frequently in order for the milk to come in, which means that volume has increased and the production has increased. So it's not, usually it will end up, not always, but often it will end up causing supply problems if we don't get that frequency in the early days. And sometimes people just haven't been told about this, and they're kind of thinking like, well, there's not a lot of milk there, so just wait until day 4 or 5 and don't pump, in the meantime, but that can cause supply issues. Okay, so we want to think about the frequency is really important early on in order to bring that supply in and have that volume increase. Okay. All right, so frequent removals, frequent effective removals, supply and demand, that is like the basics of what's important for a milk supply to actually get started and to come in and be maintained. Okay. So a couple resources that I don't have time to show all these, but I really want to share them with you, is firstdroplets.com is like, if you did nothing else except watch this video at firstdroplets.com, that is my highest recommendation of like homework to do. Okay, so after you finish this, pull up firstdroplets.com and watch that video. Really, really helpful. She talks about multiple different things, but one of the topics in it is hand expression and thinking about if hand expression, potentially prenatally after week 37 and with a low risk pregnancy, and hand expression after the baby's born, it just gets extra milk removal. And I'm pretty convinced that if there's a golden ticket to milk supply going well, like this is it. The stuff she covers in this video, firstdroplets.com. Okay, so really want to highlight that. Another great site, especially thinking about this frequency of milk removal and feeds, kellymom.com is a fantastic site for anything breastfeeding related. It's created by another IBCLC. It's really digestible, but it's evidence-based, and she links out to studies and other really quality sources and things. So kellymom.com in general is a great site. She has a page I love that's called Breastfeeding Your Newborn, What to Expect in the Early Weeks. So a really good thing to read, an overview, and then click on any other links on there that you're interested in. Okay. So next we are going to talk about feeding the baby, so actually getting food into the baby. Okay? And we're going to talk about first breastfeeding, direct feeding, and we're going to talk about bottle feeding as well. Okay? So for breastfeeding, what we really, really want to focus on, and you may have heard this, is getting a really wide mouth from the baby, and that gets a really deep latch. Okay? So I'm going to start showing my visuals here and see how wide, look at this little baby, those eyes and everything. So cute. But this is just showing, we can open our mouths really wide, right? And babies can't. So the reason we want this is that we want that mouth to be really open wide and land deep back. When they talk about a deep latch, we mean shallow is like too far forward. Deep means that mouth is landing really far back, okay? The reason that's important is, first of all, they can remove more milk this way. When they're back here, that actually gets more milk to them, okay? If they're just shallow here, just on the nipple, not as much milk comes out, okay? So, and the more milk removal we have, the more it's helping supply, right? So if we don't have really good feeds going on, that can actually hurt supply coming in and increasing. So we want that milk removal to go really well for the baby, but also for the supply. The other thing is, so if you take your tongue inside your mouth and put your tongue right behind your front teeth, the roof of your mouth, and feel there, and then move your tongue back as far as you can along the roof of your mouth. And what I'm guessing you'll probably notice is that the front is rough and bumpy, and the further you move your tongue back, it's smooth, and then you might even reach the soft palate. So what we want is this deep latch where now the nipple is in the back of the baby's mouth. It's on that soft, smooth palate. So when they're getting compressions from the baby sucking, that's going to cause a lot less pain and damage versus a shallow latch, and now the nipple's in the front of the baby's mouth, rubbing on that rough and bumpy part. And that can cause pain and damage and nipple cracking and bleeding and all kinds of stuff, okay? So the deep latch really helps with pain for the parent and also helps with milk removal, okay? So let's see what I have next. Okay, we're gonna watch just a minute of this video. I'm not turning the sound on, okay, just so you're not surprised. I'm gonna kind of explain what it is. And I'm gonna skip ahead a second. So this is an ultrasound of a baby actually breastfeeding. And at first you're not gonna really know what we're looking at, but it's gonna show us in a minute. So let me pause here. So what we're seeing is the roof of the baby's mouth. And then this kind of white circle right here, that's the nipple. So this is the breast and the nipple in the baby's mouth. And the tongue is doing all this action, this motion. And then it's gonna show us, okay, so here's the animation of this. So you can see how far back in the mouth that is. And now it's at the back of the mouth, right? If it was more shallow, then we'd have it on, then we'd have it on the front of the mouth. So we really want that deep latch to get back far in the baby's mouth. Okay, so how do we do this? We want that baby to be really wide mouth as they're going onto the breast. So how do we do this? The first thing is, when we're positioning the baby at the body, there are some things we want to keep in mind to make it easier for the baby, okay? So first of all, if I have the baby like this, and I'm having them turn their head to get to me, that's not going to be as easy for them, right? I mean, am I going to feed well like this? Let's say I ate my whole meal turning my head to the side. That's probably not going to go very well, right? So they want this in alignment. So the way we do that is the body of the baby needs to be towards me, okay? And now we see the head and the spine is more in alignment, right? They're not having to turn their head. We've got them on their side from their hips to their shoulders are all the way against me, okay? And this would be in any position. So even if I'm feeding in football position over here, not having them turn their head, I want them on their side, okay? Any position, they're in alignment. I might be reclined back and they're going this way, okay? So first thing, this is really common when I'm working with clients. It's like, okay, let's just try and turn them in and then they feed better. Just that can make a big difference, okay? The other thing is I don't want their chin having to go down on their chest, okay? If you put your chin down and try and swallow, you will find it is not very easy, right? Put your chin down and try and open wide. That's real hard. If you've got a water bottle, take a sip in your mouth and then go down and try and swallow, and you'll feel how hard it is. What we do ergonomically is we lift our chin up. If I'm drinking something, I naturally lift my chin up, right? If I'm chugging something, I really lift it up. So we want to make sure they have that space. So the way we do that is we don't want them to be too far over having to put their chin down, okay? We want to make sure they are in here and their chin go up. Same thing in football. If they're too far forward, chin's having to go down. But if they're back, that chin is away from the chest for them to latch on, okay? So any position. Reclined back, I could be laying in the bed on my side and the baby's laying next to me, right? I could be football, I could be cross cradle or cradle, that's what these are called. Any position we have the baby in, we want their head and neck in alignment, which means their body is all the way towards me and that chin is away from the chest, not having to go down like that, okay? The other thing is that we want them to feel really secure. That usually means pillows under them and under your arms. Okay, so I'm not having to expect my muscles to hold them in this position for 15 minutes securely. Okay, giving yourself some support. But if they feel like they might fall away, they're not going to be able to focus on feeding and feeding well. So they should be, really well supported, not feeling like they're going to fall. You should be well supported, so you're not having to lean towards them or lean to get to them. Okay, all of that really helps them be able to maintain, get on that deep latch, but also maintain that feed. Okay, so positioning is kind of the first thing. And if that is going well, it usually helps them be able to open wide and get on. But latching on is the next thing I want to show you. So there is a technique, and this is on our YouTube channel. And basically what it is when their chin comes in first, there is this instinct that when their chin feels pressure, it's like this instinct that they open wide. Okay, so when they feel the pressure, they go into the breast and feel pressure on their chin first. They naturally open wide, and then we can get that nice deep latch. Okay, so rather than trying to get the nipple into their mouth, chasing them around and trying to get it in, your job is to think about get that chin to touch first, and then when they open wide, you kind of help them over it. Okay, so again, there's a video on our YouTube channel showing this, but the big thing to remember and to play around with is that chin touching first, okay? So the nipple is kind of starts up at the nose, but we don't have to be moving it. Sometimes people get told like, move the nipple down, but then they're landing with their chin down. So it's that chin coming in first, okay? So if we've got nice positioning, and then a lot of times that chin going in first really helps them get nice and wide latch and get a good comfortable latch and get a lot of milk removal. All right. Did I cover everything I wanted to there? I think so. Okay, so a couple other resources I'm just going to touch on. So these are the same from earlier, and these both have information on latching the baby on too. And then I've added here, naturalbreastfeeding.com is a really nice site. It's got videos and such on that recline, that laid back position that a lot of times people don't know about. It can be so comfortable, and it actually can really help the babies latch on even better. So check that out, naturalbreastfeeding.com. And then I mentioned our YouTube channel. So it's Breastfeeding Center of Ann Arbor. We have that video of latching on with the chin touching first. And we also have other videos on paced bottle feeding, which we're going to talk about in a minute, and hand expression and some other things too. So our YouTube channel is a resource for you as well. Okay, so next we are going to talk about trusting your breast milk supply. So when the baby's feeding at the breast, we don't know how much they're getting, right? We don't see it. It's not like when it's in a bottle and we can actually see the volume. So it's hard to know, okay, is the baby getting enough or not? So again, we do have a handout that if you come in to the center, we will give you this. But what the information it has is exactly what it says here, that your baby is getting plenty of milk if, and notice that there's a lot of things here because we really want to look at the whole picture and see kind of how many of these do I feel like are happening, or do I feel like most of them are not happening? So we've got by day 6, your baby is having at least 6 wet diapers per 24 hours and yellow poop. The poop going from brown to yellow by about day 4 actually is really a good sign. Okay, and the earlier days of life, like day 3, we expect 3 wet diapers. Okay, it goes up each day of life. And then by day 6 and beyond, it's 6 wet diapers per 24 hours. Okay, so enough wet diapers and enough poop. If it's going in, stuff's coming out. So knowing, what to count and what the minimums are can give you a clue of like, okay, at least they're getting enough to be making these diapers. Okay, we also want to see that the baby is gaining 1 ounce per day on average after day 5. They lose weight at first and then they start gaining around day 4. So after day 5, the average we expect is 1 ounce of weight gain per day. It's not going to be exactly 1 ounce every day, but over a week, over 7 days, I want to see 7 ounces of weight gain. That is really the proof in the pudding. Like if they are gaining well, they are getting enough. If they aren't gaining well, even if all the other signs look good, they aren't getting enough. So that really tells us, yes or no, and really the trend. Okay, maybe like 1 data point I might not be too concerned about, but if it's trending lower than 1 ounce per day over time, that definitely is telling us something. Okay, but you probably don't have a baby at scale at home, and I'm not going to recommend, I don't think everybody needs to run out and buy a baby scale. This is what pediatricians are tracking. We have the scales in our office. We're looking at that. So your team's looking at this, and we want to use these other signs when you're home with the baby, as other signs that you can use in between the weight checks. All right, so we've got your baby seems happy and content for 2 to 3 hours on average after a feed. If they fed and then 45 minutes later, they're constantly hungry again, you're only getting half an hour, 45 minutes, or an hour before they seem hungry again, that's telling us something. That probably means they're not getting full feeds, okay? Your breast getting softer during nursing? Maybe, maybe not. Some people notice a big change. Like it's like, yeah, my breast is less full. That volume went somewhere, it went into the baby. Some people don't notice that much of a difference. So that might be a good tool for you. It might not. The baby actively feeding and the baby having lots of deep, slow chin drops. So what that is, and this is what we help, families a lot of times know kind of what to look for. But what that is if they're on, but they're not really doing much, or they're just doing little or a couple of sucks and then they stop. and then a couple of sucks and then they stop, right? That's a different feed. I don't feel like they're probably getting as much as like consistent, rhythmic, big swallows for a pretty long time, okay? So that's what that means, those deep, slow chin drops. Their chin is like open and closing, and that is active feeding. All right, so using all of these to kind of feel like, all right, do I feel like things are on track or not? If you're seeing most of these signs, you probably feel like things are okay. But there's times where it's like, well, the baby seems content after feeds because they're asleep all the time. You know, newborns can be pretty sleepy. So then we got to think about, well, yeah, they're content, but do I really feel like I'm seeing a lot of active feeding? Am I seeing enough diapers? Am I seeing, more than the minimum? And if in doubt, if it's like I'm seeing one or two of these signs, but I'm not sure, get support. Okay, that's exactly what we do. You could start with your pediatrician as well, if you just want to get them checked out. But this is a huge part of what we do is the baby getting enough, from the body? Okay, but these are some things you can have at home to kind of be watching for. All right. Okay, so if all of these things, well, let me go back here for a second. If that positioning, that latching, even these things that I have on the slide here, if that's all going well, if you feel like, yeah, I'm doing the positioning the way she said, I'm trying that chin first, they're opening wide, but I'm still in pain during or after feeds, okay, at breastfeeds, or the baby's not getting enough. The baby's on and doing work, but then they seem hungry 45 minutes later constantly, or any of those signs, it might be that the baby's function is part of the issue. And this I see all the time. I really, really, really wish this was something that more parents heard about and were aware of, that the baby's ability to get full feeds from the breast or chest is not necessarily like full ability, full function. They can get full feeds every time. Okay, a lot of babies don't have that full ability at first, and that doesn't mean it can't get there. And a lot of times we put a plan together with families of how are we going to get them there. But what can happen is the baby is causing pain to the parent because maybe they have extra tension or they have, just something going on where their jaw, their tongue, their lip, everything that's involved is not moving or sealing or doing what it's supposed to do perfectly. So then they might overcompensate with some more clampiness, or their tongue is moving differently than we expect. And that can cause pain, and that can cause them to not be able to get those full feeds directly from the body. So the baby's function, the baby's ability is a huge part of the picture. It's pretty common, unfortunately, for that to not be going super well. The baby's not getting full feeds. So then the parent's body isn't getting that demand signal as strong as we want, like we talked about, and then their supply suffers. Their supply isn't as high as it should be, as we need it to be, or it's even decreasing. And the parent can feel like it's my fault, my body is failing, my body's not doing it, but really it was that the baby wasn't able to remove the milk well enough, okay? And that doesn't mean it's hopeless. There absolutely are ways to improve that ability for the baby. I don't have time to go into a lot of that today, but I just want to put that out there that it's really possible that the baby's ability isn't 100% at first, and we make a plan for how we get the baby there and what do we do in the meantime to build and protect supply. Okay, so I'm just going to touch on that for now, but I did want to mention that. Okay, and with that in mind, one thing that I do recommend people prenatally a lot is getting a pump and getting it ready, like washing all the parts, having things ready before the birth. I find that a lot of people think like, well, I'll just wait to get the pump, but you could end up needing the pump like day 1, day 2. Like, oh, this baby is causing me a ton of pain and I can't use them to do the milk removal. And while I'm working on figuring that out, we got to start pumping right away. Okay, so getting that pump. And even like if you're giving birth at the hospital, just have it in the car. Like you don't necessarily even have to bring it in with you, but have it in the car. That way, if you need it, somebody can run down and get it for you. Okay, but don't wait on the pump. Get the pump, pick it out, get everything ready, bring it with you, to the birth or have it available in those day 1, day 2, right after, just in case you do need it. All right, so bottle feeding. Let's talk about techniques for bottle feeding. Now, a lot of these you're going to see are in line with what we just talked about for breastfeeding, because we really want to make bottle feeding as similar to breastfeeding as we can. This helps not only if we have a baby that we want them to be bottle fed and breastfed, this helps them go back and forth. But if we have a baby who isn't doing well at breastfeeding, but we eventually want them to get there, this helps them build the skills and the strengths and that ability to be able to, okay? It also helps, even if this baby is never going to feed at the breast, it's still a healthier way to feed. It's a more biologically normal way to feed. So what this is called paced bottle feeding, like slowing the pace of the feed. And you can see in this picture, which by the way, this is one of my best friend's daughters, and her birthday is today. She turns 2 years old today. So this little baby in the picture, today is her second birthday. Fun fact. So anyways, you can see that the way the dad is holding this baby is really upright, and that's what we want. So if I had this baby on my lap, that's kind of what we're picturing, okay? I'd be holding this baby upright, and you can see here this support behind the baby's neck can be really helpful, okay? But sometimes people hold like that, if that works out, all different ways. But we've got this baby pretty upright, okay? And that way the bottle is going to be pretty parallel to the floor, not tipped up like this, okay? What we see all the time, what looks really normal, is this, right? This is actually bottle feeding we don't want to do. We want that baby more upright so the bottle isn't tipped up and gravity is not the thing pushing that to them. Okay, when they're feeding like this, some babies really can't handle this. Like they have to keep swallowing or they're going to choke. And some of them just start letting it spill out of their mouth, or they start turning away, or they, just really have a hard time with this. Some babies can handle it, but they're chugging this down. That's basically what's happening. So they're going to actually swallow a lot more air this way. And that could be more fussiness. That could be less sleep. So this can really get in the way if they're just chugging down, they're swallowing a lot of air, okay? This way, what happens is now they are doing the work. Their compressions and their skill is what's getting that milk out or that formula or whatever's in this bottle, okay? So this way, they're able to drink, but they're also able to pause. You should see them take a couple seconds where they just stop sucking, they take a little breather, and then they keep going again, okay? So this slows the pace for them. It makes them in control, not having to chug, okay? They're in control of the pace they want to be. And this will make this bottle feed about 15 or 20 minutes. A full feed like this, we expect this bottle to take about 15 or 20 minutes. Okay, that's also the amount of time it takes for your brain to catch up to your stomach and realize, yes, I'm full. This way, they can pretty easily be quite overfed because they suck this bottle down in 5 or 10 minutes and they think they're still hungry. And that's how they end up with larger and larger and larger bottles, way larger than that chart I showed you. This way, they usually stay in that range and they really are full, after an appropriate amount because it took them 15 or 20 minutes. Okay, if this is taking a really long time, like every feed is taking 30 or 45 minutes, then we make it a little easier for them. We kind of lift it like this, but that is very different than that. Okay, as this gets more empty, you're going to have to lift it just to literally get the liquid up in there. Okay, but you're still kind of aiming for the liquid to be right about covering the front of the nipple, just covering the hole. And we do have air. And a lot of times people have been told, don't let there be any air in that bottle nipple. They'll swallow the air. That's a total myth. Okay, they actually swallow a lot more air this way. This way, again, they have that time to pause, to breathe that air out their nose, to take a little breather, to not be taking huge chugs every time. So they swallow a lot less air this way. Okay, so every bottle, no matter what's in this bottle, no matter if this baby's ever gonna breastfeed or not, this is really how bottles are supposed to be fed, okay? And it really just helps the entire kind of health of the baby. And it also helps them to know, okay, I do the work. So when I get to the breast, they realize that's how the milk flows. You gotta do the work, not I just open my mouth and it starts flowing in and pouring in, which is what they get used to with this. So this whole idea of like nipple confusion, it's not the nipple, it's what do I do? It's if they get used to this, then they get on the breast and they're like, it's not working. Like, what do you want me to do here? Okay. This is a lot more what they have to do with the breast. Okay, so they get on the breast and they know what work to do, and then we avoid that nipple confusion or bottle preference or things like that. Okay, so there are other videos on our YouTube channel, like I mentioned, about paced bottle feeding that you can watch and you can share with anybody who's given your baby bottles. Okay, so that is a huge thing that really helps. Again, most people are doing both bottles and breast. And even if not, it helps when we're bottle feeding to have less air in, less gassiness, less fussiness, better sleep because of all of that. So it really can help with all of those things. Okay, so that is all the main techniques and things that I wanted to share today. But I want to wrap up with some information kind of about what to expect, if you are expecting, if you haven't had your baby yet. The early first couple of weeks, let's say like 4 to 6 weeks probably, are absolutely the roughest time, okay? So this whole, again, showing this visual again, which I love this. When I posted this on Instagram, it's the image we've gotten the most likes, right? Like people really relate to this. Because this idea that we're telling people that are breastfeeding that, oh, it's just gonna be so easy and natural, I really feel like that's setting people up for being real surprised and disappointed when it doesn't go super easily and naturally, which it doesn't for most people. Okay, so I was looking up some studies recently on Google, just kind of refreshing, because I've seen this before, but study after study really shows that early on, it's completely normal to have challenges with breastfeeding, and really probably with any infant feeding and just with newborns in general. But especially when we're looking at studies on breastfeeding, I found one that said 90% of families that were breastfeeding had challenges in the early weeks. 90%. So it's like, it's almost like that's what to expect. And I'm not saying this to scare anybody or to make it sound like doom and gloom or anything, but I really want this to be normalized because I've had so many families come in and say, how did no one tell me how hard this could be? Like, why didn't anyone tell me this? And their expectations, are completely different than reality. Another study showed that it was 75% had issues within the first month. Okay, so I'm giving you these numbers just to make sure you know that if you run into challenges, it's not that you're doing something wrong. It's not that there's something wrong with you or your baby. It's not that, oh, I guess breastfeeding just isn't for me and I better stop. It's the norm. It's the norm, okay? And I've been thinking a lot lately about how this would be like, if we didn't tell someone who was pregnant and was going to go into labor, if we never told them that labor is hard and challenging. Like we all know that, right? We know labor and birth, we expect it to be hard and challenging. And what if no one ever told you that? And everyone was like, your baby's amazing, your body's amazing, it's just going to happen and be natural and beautiful. And then you went into labor and it was really hard, you would be terrified and you would have no idea what to do. And I almost think that's what we're doing, to breastfeeding families, that we're not letting them know it's normal for it to be hard, especially the early weeks, and then it gets easier, okay? And the other thing is, we know with birth and labor, you probably have your team of people who are gonna be your support. So you're working with a midwife or an OB, maybe a doula. If you're gonna be in the hospital, you're gonna have nurses, you might have your partner, you might have a support person. There's these experts that you have planned to be part of your experience, that you're leaning on for support, right? You're using for support. And I don't feel like our society talks about lactation support that same way. Like it's less common for, you get the question of, oh, who are you using for your OB or your midwife? It's less common to hear, who's your lactation consultant gonna be? Like just that's the norm, that should just be expected if someone is planning on breastfeeding especially. But like I said, any infant feeding, plans we can help with. So we're really setting families up to not realize, that there's probably gonna be challenges and there is support out there that is insurance covered to help with this. Okay, so again, this kind of thing what's on here of the reality, it's not that you're doing anything wrong, okay? It's that that's very normal and there are resources out there to help you with that, okay? So last thing is what are resources we have. So I'm especially highlighting things on here again for prenatally, but we have our private consultations, of course, I talked about those earlier. We do full prenatal consultations. So if you have things you want to plan for more, you want more information, you have any specific needs or health concerns or anything going on, we do private consultations prenatally as well. And also throughout, an entire feeding journey, we always say we're with you from the beginning to the end, whatever that looks like for you. So by milestones, I mean things like going back to work, and childcare is now in the mix, and pumping at work and that kind of thing. Adding in solid foods around 6 months. Breastfeeding at a year and beyond. What does that look like when we're heading into toddlerhood? And weaning and decreasing lactation at any point that's right for you. Sometimes this is a toddler, and now I want to think about what's that going to look like. Sometimes that's, okay, I've done this for a couple of weeks or a couple of months, and I'm ready to make a different plan, and I kind of need an exit plan, and we are very, very happy to help with that. Absolutely no judgment there as well. Okay, we also have our podcast that is called All Things Breastfeeding. So you can check that out, especially the parent interview episodes. I'd really recommend to hear some people's actual stories. But there's lots of info episodes too. And we have our Friday morning free mom and baby group. And you're welcome to come prenatally to that too. But that's at our office. We have the baby scales available. Sometimes people don't need a full consultation. They just need to be checking that baby's weight, ask some quick questions to us, little check-ins. So we've got that available, and information's on our website. And then finally, I really want to highlight this new breastfeeding prep package that we just launched. So this is a full self-paced online course. So really what we talked about today is like the essentials. It's really like me trying to get the most important information out. But there's a lot more that I think you could learn prenatally that really would help you too. So that's all in this online course, and that includes a Q&A session privately after the course as well, okay? And I've created a discount code. So if you would like to use this discount code through the end of December this year, 2024, the first 5 people to enter this code in online get $25 off. So that package is $100 for the online course and the private Q&A session, okay? So all of this is on our website, bfcaa.com. And you can email us at team@bfcaa.com anytime. Don't be worried that's going to like some giant team and you're bothering people. It's a small team, and pretty much I'm the one like getting all those emails and giving them to the right people. So email us anytime with any questions you have about these resources, or if you could use just some support in any way, okay? So thank you so much again to everybody for listening. Thank you to the library for putting this on, the Ann Arbor District Library. And I wish you the best of luck and the best pregnancy, birth, postpartum, and feeding journey. Thanks so much.